Hello, this station will be about dissociative stupor, and this station is interesting to be performed. And one of the most difficult points in that station is defining dissociative stupor to the mom of the patient. But it's too easy to be explained to her. After introducing yourself to the mom and after saying, "Hello, Mrs. Franklin, thank you for coming to meet me today. I understand that you have some concerns about the condition of your daughter, Sarah. I am here to help and to explain what is going on with her and how we are going to manage her condition. And if she asked you about the diagnosis that was established with her daughter, you can say that according to the assessment done in the medical unit and after exclusion presence of any organic cause behind her symptoms, the diagnosis of dissociative stupor was established. Have you ever heard about it? Usually she will tell you no, and then you can continue. Dissociative means being detached and away from reality. And this is happening usually when the patient faces stress that he couldn't tolerate and that he is not able to manage it. And the stupor means being non-responsive. I mean, patients who are stupors are usually not talking, not speaking, not swallowing, or even changing their gaze. This non-responsiveness is happening while they are conscious. And then, if you are asked by the mom about the etiology of this condition, just try to make it two-way conversation. Instead of informing her about etiological factors, you can make it as a questions from your side by telling her, actually there are more than one factor linked to this condition. I'm not sure if Sarah has any or all of them. First of all, presence of family history of similar condition can increase the possibility to have this condition, and give her a chance for 2 or 3 seconds to add input regarding this. You can continue. The type of personality also play a role in experiencing such disorder. If the patient is anxious in her personality, and to stay for 2 or 3 seconds and see what the mom will add. And then you will come to the most important part in this station by telling her, in some cases, there are clear stress that happen so close in time of experiencing dissociative stupor. Are you aware if Sarah has been experiencing any difficulties lately in her life? Here, the mom will provide you with a story and some issues between the patient and some other important people to her, and you need to reply to this by telling the mom, "Oh, I'm sorry to know that Sarah was experiencing all these problems lately. But on the other hand, it is something great to have clear stressor like this, because this has a good impact on the prognosis or the final outcome of her condition, because with knowing the stress the patient is facing, this can help us to work on that stress to help the patient to overcome this, and this will help her not to re-experience dissociative stupor later on." And if you are asked, how are you going to manage patient's condition? The most important thing, the support of her body. I mean, you need to inform the mom because the patient is not eating or receiving any nutrients, and because there are some salts that are essential for functions of important and vital organs of the body, like heart and muscles of breathing. So providing her with those important salts is essential at the moment. And also keeping an eye on her and monitoring her vital signs frequently is important to find out any physical problem and to manage it accordingly. Besides, the medical team are going to provide the patient with benzodiazepine, which is first-line treatment for dissociative stupor, and you will see if she will respond well to it or no. Once you find that she is not responsive to considerable and enough amount of benzodiazepines, then we can transfer to the second-line treatment for dissociative stupor, which is ECT, the most effective treatment in the whole psychiatry, including dissociative stupor, and give the mom a chance to ask you about ECT and if she knows any information about it and address her concerns. And then you need to clarify to the mom that all these treatments are the short-term plan. Once the patient regained her responsiveness to others and started to talk and to swallow and to move her body parts, at that point, the second phase of treatment will start. I mean, starting her on psychotherapy smoothly and gradually by start to talk to her by specialized and well-trained psychotherapists who can discuss the difficulties she is experiencing at the moment and helping her to improve her social, personal, and problem-solving skills, focusing on her relationships. And this type of psychotherapy will be provided in the form of weekly sessions, and it will continue after discharging her from the hospital. And if the mom asked you about her role of supporting her daughter, you can simply reply, the most important role you can do is to encourage her to comply with her medicines and with attending her psychotherapy sessions on time, and to listen carefully to her and to be in contact with us whenever needed. And thank you.